Today's video is for the whopping 1 to 3% of you out there who have geographic tongue, otherwise known as benign migratory glossitis. This is a condition involving your tongue where you have these red, smooth patches in a map-like configuration. It comes and goes, and the patches tend to move around on the tongue. Why do you have it? And is it a sign of something sinister going on internally? Listen, before you go running to Google to terrify yourself, if this is the first time you're noticing it, it's called benign, meaning it's not dangerous. Now, why you have it? Good question. We don't really know why people develop this. It appears to be a lot more common in women than men. While it can occur in children, it primarily affects adults. There's definitely a genetic component because it's more likely, if you have it, that someone else in your family has it. So you can blame your family. There's also a strong association with having geographic tongue and a variety of inflammatory conditions, especially psoriasis. In fact, many people with psoriasis will exhibit geographic tongue before they even notice skin psoriasis or joint symptoms. There's no correlation, however, with bouts of geographic tongue and flares of psoriasis. They don't come and go together. There's also a strong association with having geographic tongue and what are called inflammatory bowel diseases, namely ulcerative colitis and Crohn's disease. Now, these conditions can lead to things going on in your mouth and your lips in a variety of different ways, and geographic tongue is just one of these ways. Several people with geographic tongue have a tendency to have conditions that are allergic in nature, such as seasonal allergies, hay fever, allergic rhinitis, asthma, atopic dermatitis. Some people even have certain food allergies, although geographic tongue is not a sign of a food allergy. And again, consumption or exposure to the food allergen does not necessarily trigger a bout of geographic tongue, but they do seem to go together. Certain medications also can trigger bouts of geographic tongue, namely lithium, a medication used to treat bipolar disorder, as well as certain medications used to treat high blood pressure. Oral contraceptive pills may also be a trigger for geographic tongue in some people. For the most part, geographic tongue doesn't really bother people in terms of symptoms. They don't really notice it unless someone points it out or they happen to look in the mirror. However, it definitely can burn and sting. What's going on with the tongue when you have a bout of geographic tongue? Well, the working theory is that there's some sort of inflammatory response going on, and that inflammatory milieu negatively impacts the normal turnover and maturation processes of the cells comprising the tongue, the keratinocytes. These are the same types of cells that comprise your epidermis. Just think of your skin when the epidermal turnover processes are a little screwy, maybe because the skin has become dry. You get patches of dry, rough skin texture, or you may get little rough bumps around the hair follicles, or you may get pore clogging and lead to acne breakouts. Well, those normal turnover processes that occur in the epidermis, they likewise have to happen on your tongue, and certain things may be messing up that normal turnover and maturation rate. And that's what is thought to lead to the development of these red, smooth patches and a map-like configuration on the tongue. And some people, again, have symptoms of tongue sensitivity. Almost like with certain skin conditions, you also can have a heightened sensitivity to things that come in contact, say, with your face, like certain moisturizers burn and sting. Same thing can be going on with your tongue. Now, for patients who deal with bouts of geographic tongue, it's important to see your healthcare provider, especially when you are in the midst of a bout of it, to have it evaluated, because there are other conditions that happen on the tongue that kind of look similar. For example, thrush, which is just a common name for a candidal infection on the tongue. Also, a condition known as lichen planus can create a lacy-like pattern on the tongue and sensitivity, discomfort. As a side note, I have a video all about lichen planus. Check that out. With certain nutritional deficiencies, you can develop a smooth, swollen, inflamed tongue that's known as atrophic glossitis. And initially, that might look a little bit like geographic tongue. So as always, don't try and self-diagnose. Now, if you deal with geographic tongue, what can you do about it? Like, is there anything that you can do to maybe control it, especially if you have symptoms of like burning and stinging? Well, your doctor can prescribe some things to help alleviate the discomfort. A topical anesthetic can be prescribed that you swish around in your mouth to sort of numb the tongue and alleviate some of that discomfort. There's definitely an inflammatory component going on that drives this. A lot of patients see success if they are given a prescription for something called tacrolimus. Tacrolimus is an immunosuppressant. When a patient has an inflammatory condition of the tongue or in the mouth, one thing that can be beneficial is to take a pill of tacrolimus, dissolve it in water, swish that around in your mouth like a mouthwash, spit it out. It's enough to deposit that medication in the mouth surfaces, calm down the inflammation, and get you some relief. We use that to treat other inflammatory conditions in the mouth, like lichen planus, which can definitely be very painful. I suggest aggressive oral hygiene, regular flossing and brushing your teeth. And I know you're thinking, but this is my tongue. Yeah, but your whole mouth can harbor bacteria and things that create an environment of inflammation that is pro-inflammatory in a negative way that impacts the differentiation and maturation of the cells that make up your tongue. So regular flossing to keep the gums healthy, the spaces between your teeth clean, brushing your teeth can all be super beneficial for just helping cut down on bacteria in the mouth that might aggravate this. Regular visits to the dentist, of course, for your routine dental cleaning. Don't get behind on that. When it comes to oral hygiene, the devil is in the details because the toothpaste, the mouth rinses that you choose might actually be aggravating. I always suggest to people, whether it be for this or anything going on in the mouth, consider a trial of a kid's toothpaste. Make sure it has fluoride for cavity prevention, but kids' toothpaste tend to have gentler flavors. Mint, cinnamon, spearmint, peppermint, wintergreen. These can be very irritating in the mouth. Cinnamon, for example, has cinnamaldehyde, causes vasodilation. It can bring in a lot of inflammation. Activate something called TRPV1 channels, bring in specific aspects of inflammation that can aggravate this for you. The other thing about some of the kids' toothpaste I have found is that they don't have as much of the detergents, the foaming ingredients that help distribute the toothpaste around, but also can be very irritating in the mouth. So that's another reason to consider choosing the kids' toothpaste. You also need to be careful of your dental floss though. Choose a dental floss that is not flavored. A lot of them are. You might consider getting a water flosser as well. That may help with the gum health and cut down on problematic bacteria in the mouth. Aside from oral hygiene, you might need to be careful with what types of snacks, foods, etc. you choose, and beverages, because certain spices can aggravate this. Mint, again, cinnamon. I always warn people who have this or get canker sores or have oral lichen planus. I warn them about Doritos. I just use Doritos as a common name example, but really there are a ton of different snack foods like Doritos that have this feature in common, I'll say, of that aggressive flavor coating, which is delicious, all right? But it really can be tough on your mouth. And of course, those types of snack foods often have sharp edges that, can leave your mouth just feeling raw. If you eat them regularly, or you maybe eat a little bit too much, they can really tear up the inside of your mouth. Certain cereals, Captain Crunch, intense flavors, rough surfaces, that can be hard. It's not to say you have to eat completely mushy, soft foods, but these kind of snack foods that are like very, very, very flavor intense and sharp, you might want to avoid. Also, chewing gum. It can be a blessing and a curse. Chewing gum is helpful. Chewing sugar-free gum with xylitol in it as a sweetener, and yes, I know that's bad for dogs, but chewing that can be helpful for the bacteria, cutting down on bacteria in your teeth, reducing plaque. But certain flavors might actually aggravate the symptoms in your mouth if you have burning and stinging, so be aware of that. Like the bubble gum flavor is probably the safest. Cinnamon, mint, that can be aggravating. Also, certain candies you want to be careful of, like Pop Rocks, probably not a good idea if you have migratory glossitis or you have anything in your mouth, any kind of oral mucosal condition, because it can just be very aggravating. Water. Everyone on social media likes to tell anyone with a skin problem, just drink more water, right? But drinking water is very good for your teeth, plain water. It's good for your oral hygiene. It cuts down on mouth dryness, and it also just helps to move things along and prevent prevent tooth decay. It can be very helpful for reducing tooth decay to just drink regular water. Don't drink sodas, juices, things like that. But if you have geographic tongue and it doesn't bother you, you don't really have any symptoms, it can just be like your little personal quirk. You don't necessarily have to do anything, although of course I do suggest everyone to have good oral hygiene, but you don't really necessarily need to modify things. But if you're really struggling with it, you're having bouts of it that are actually uncomfortable, I would suggest doing some of these things or trying some of them out, seeing if they help. Anyways, guys, I hope this video was informative to those of you out there who have geographic tongue. It's not super common, but I know a lot of people have it. Now, like I said, it can look like several other things. So on the end slide, I'm going to put one of my videos on a white tongue, and I go over different things that can be going on your tongue, many of which look like geographic tongue. So check that one out next if you missed it. But if you liked this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!